Iqaluit is Friday, April 23rd. As always, we have the same lineup: Premier Savikataaq, Minister Kusugak, and then Dr. Patterson, and then we'll get right into questions. We will be back next week at the same time, Monday, Wednesday, Friday at 11 a.m. In the meantime, have a good weekend and stay safe.
Ula sakul lumitallam April 23 tema China sibulak to halimalaw lunan minister ana hamnang itulari kunut amaluluta Patterson pinasaw siula to me utilap to naggadjaw pingat siktalem iliapamokat pinasaw siulo khatsarit sinungwan
Nunavut me black ko chapapi ublumita kwa 9 go yunuta nuwan na Nunavut iluani hakke hat ublubi Amata ko 8 nuvan na yo akaron ne to mami himalek to nuvan na yo ami man now yo 37 nuvan na yo akakto nunubu iluani 33 akalung ni amma hitamat Kinngait ni ublumi mitikid liuta ko nuvan na yo ta ko tumi kapiyo himayut 14,915 himudla pa mi kapiyo himayut Mata ko kingun lang may tuglia ni kapiyaw himayut nuwan na yo atare ko timi 11,940 manunubu miumat na awak paka naalat siyata matata ko anya talitichi ko malik daw ko yung ita nuwan na yo at angin nilang iman ay tuloy lang inapta kawaya mo yung ata na takanak tuyulak o kiwataw yung ata nita nuwan na yo may pilira kalerapta tabbo huli pilira yabut kihani kawi mayong atana nungu katang na uban na yo ano bu ilwani halagi katang na tabuta ko tak chaluti nala chaluti halagi na tabutam na uban na yo ano bu ilwani amata ko kawi mayo ma sungata ko takanak tu yo mata ko ai himaga khakta to anit teliga khaktu Kihani mat na awas lagi amma kodai wak sungata kwa nala chata mata ta nuban na wak mi aik to loi langi mata nuna liu iluani angi langi man amata na hanat tai di unalek to mi kayu mi kikik talung ni amma kangas tenang mi kawi mga mata kwa ukwa terpalya himang mata ta kwa tai kwa tai kangas tenang mi utak kikik talung mi utak nala chala ta kwa malik tau ko yabut ta ko uwap tinni nagligiyap tinni kakanap tinni ilap tinni innakot tinni ikayaw na ta dan nuban na yak ihulin na mata nunaliwilwani upalubaik to lang inapta angin dilang iman ama himalutit himalwan na Covet kidamya mo kalugit inutung itutit talafotikut kakatawyakut kanumya ikayok to yulwa kabit hulwang ilwan na Covet ihmalwan na Covet mat na kimabu ko yali mal tunga ta ko ai himage lead akon na kalwak tilu ai himaw ya ho mata anit daily lutit amma kingun lang may tano kay na hok taka aniya kang na Covet kina pang mato ame atoma kotin agati ang mitsa talugit hilami ko bita ko itigay 6 feet unghek tigilutit inup kanang kanigilwak tangilutit ai himamara ublaluk tangilutit matana kingun lipa lari kapiyaw himang inakuwinuwad na dawata aray katumi kapiyaw yak to kumakutit matana kapiyaw himan na kuwi tuglia ni kapiyaw ka na kumakutit nunabu miumat na pagka tana nuwan na kuya takanak to iwala ki halagin na tabu mat na uyo. Good morning. Today we are reporting 9 new cases and 8 recoveries of COVID-19 in Nunavut. There are 37 active cases in the territory, 33 in Iqaluit, and 4 in Kinngait. To date, 14,915 Nunavut have received their first dose of the Moderna vaccine, and 11,940 Nunavut are now fully vaccinated. I'd like to thank all Nunavut for their continued effort and patience. It has been a very long, hard year, and unfortunately, we are still going at it, but I know we can do this. We will beat the virus. We need to look to the longer term and know what our responsibilities are to one another. COVID fatigue is real, but boredom is not an excuse to take unnecessary chances. It's another weekend with tight restrictions for the Kinngait and Rankin Inlet. Please do your part. Please don't take chances. Reach out if you need to. Stay connected from afar, and know we appreciate your sacrifices. As always, I'll end with this. Mask up, wash your hands, keep at least 6 feet distance from others when you're outside, stay home as much as possible, and get vaccinated. If you get your first vaccine dose, get the second. Please take care and stay safe. Thank you, Nunavut Mute, and have a good, safe weekend.
Blackwood. Covet tamani katigil na si Ublumi. Ublumi aniak tayo mayulari kut pilari yingit atong mata tamakkuninga nasalingnik. Aku kioluk takso di pilari si manikung inulubdumi kasungat jumini ang mata tamakkuninga atong mata ikayok tuktugi tapsuminga atok punga. Please don't adjust your sets. I am in full support of my health department. They are wear a hoodie to work today, so I wear this great hoodie. And no, you can't have it. Unip kakakliw mo yung taman na kapiyaw yaka kang niumiksan. Kapiyaw si maluni kisiyani. Ikayo, bigyo ako ng matamatuming unatang nang may nubagyo ang nang may. Maan na mutikit tugo atuin naktakaktok tako nga kaputinik modernamik atilingnik tamang miluktano na bumi anya wait teman na itunik atuin naktakaktok ikaditi yung abungay lipsinot taman nakaput ulogyan ng imat ama ikayutit siya nakpangong bruniman na unatakasong namay tamatumingan nuwag doang namay isumalo ti Covet apat putik sa Covet tamatumang kaputi umiksanot iling nunamang mga kapiyaw yun nang nalugubit kapwa anyabit nunapsin ni apere yun nakpasi kaya na daw blu nunabudlu ikiaksibit ko kaway sakvingin ni tayo matota makwa apet ko ti kiyaw yun naktut kisiya ni tusang iyasang nang ni takka ni ukaw siyo yun ikulukayan ang niraya yun iklutay ko nalalo kayang itakka nalagayang ityatak kalihilip siyo guma sibuko sa akin na sibukan ng ito ni sibukan naksisokalungan udyan ng mataman na nalugubit sibukan na kaubidlo tayo ko kapiyaw si mayud nunapsin ni anyawing milupilari yu tamakwa nakawiman naksawiyu yakto tamatuwa miksanon apek soklo ito kisititaw siya kayakto tin ulo kaya stug naklo sibukan naklo tamakwa atusokay kakti gusto na luktanon kasi ni kapiyaw si mablo ni ito ang nirenek tang itap sa mga kaputi uong at siya karo iso kasumong mata taman na kapiyaw si mablo ni pibalde ko tao ni nga angin naksawang at kapiyaw si mangin nakmin anyawing mutnunapsin ni kapiyaw yakto ko manakmin narunak si mangit Covet narunak si bagirit tayo ko nga kapiyaw yun nang nekawin ama ikayok tao yun nang nekluti tamatumamiksano. Today, I'd just like to speak very briefly about the importance of the COVID vaccine. As we continue to offer the Moderna vaccine in communities across the territory, I think it's important to remind everyone that the vaccine is safe, effective, quick, and our very best defense in the fight against the virus. If you have questions about the vaccine, call your health center or visit the Government of Nunavut or Government of Canada websites. All the facts and answers are easily available. But please don't assume the theories on the internet or something you heard from a friend of a friend through social media is accurate. Take the time to research and understand the benefits because science is real and this vaccine works. Being worried or scared is normal and there are potentially short-term side effects, but they are minimal and pass quickly. The pros outweigh the cons and this pandemic is too serious not to do what we can. Nunavut, please make an appointment if you haven't already at your local health center. The vaccines are here in Nunavut and they are readily available. It's up to you now to do your part. Be kind to your healthcare professionals and healthcare workers and have a good weekend. na yanguat anyawan milupilagayut tung asuk tikat taksiw ang masanan na ang itlugo kasungat siyang nakusin. Kuyan namin.
Good morning. Today we have 7 new cases of COVID-19 in Iqaluit and 2 in Kinngait, and there are 8 individuals in Iqaluit who have recovered. Given the current situation, I'm supportive of the decision by the organizers of the Nunavut Quest dog sled race to cancel the event scheduled to start April 26th. I realize that this is a significant event and one many members of the community were looking forward to. However, given the current risk, the organizers have made a decision that reduces the risk of introducing COVID-19 to multiple communities.
Ulla sakut ullumi 7 kanyannik Navajoanak 19 taksimayok tahalak tu Iqalunni ammalumakko nik kingarni. Tako ang mayu 8 sitamayok tu Iqalunni kanoy gudnero taksimayok. Taman kanoy palyaning apidjo tigillugu tay ko ikayo sotak kay sumalero takalaw tu panay yo Nunavut khimut siyo joanermik nukhapti taon niya ang apigam niya alaw tu April 26 mi. Hawi magalaw tu ngata na pimariw na hamningan ni nuna khatigi no kisya ni takwa nariw giya khatsa alaw tu nut kisya ni liman na uluga na tu ningan takwa panay sumalero takalas si mamata uluga na tu may khuyi gatik Navajoanak 19 asingin nunalin no ajiging ito no siya mapalala kunago.
I know this pandemic has resulted in the cancellation of many annual and traditional events and activities. This is not easy on any of us, but with the help and work of all Nunavummiut through following public health measures and getting vaccinated, we will get through this. Following the 2 exposure notices in bars, we have also decided to alter public health measures as they pertain to restaurants and licensed establishments. As of Monday, when these establishments, bars, clubs, and restaurants are open, they will be restricted to 50% capacity. In Kinngait and Iqaluit, these facilities are limited to takeout service only at the moment.
Hawi magalaw tu ngataman na siya mapalyaning nukhatit sigutaw sa malangami sunik akago tamat ang maloy na ipikkusingin ni kanoy lirusiyo yun ni upengakon. Taman na yung natugalo ay ilong natin no kisya ni tamako ikayok tu inaw ningin Nunavummiut balikat talo ti anahan nang ituloy na mamalit tayo kuyaw si mayunik ang malo kapiyaw katak tu ti taman na nigawin tabo. Tako makuk lalo na tawlok tilugi merbinni katiya katu minutuin nakahan ninginik isumaliw simalag mayugo tako asidjak tawlo ti anahan nang ituloy na mamalit tayo gali tamakkuno nga license hakto no imerbiyo yun. Mande mi pigyalo ni tako license habbiyo yun imerbiyo yun surlo imerbi tahanes bilo nirevilo matuing halikkata tayo maisulit tabiham na akto abbagiro na abbarilo nigita at sumakatsiw nigita inokaron ng nigita. Tamani kingan ni halon niliw tamakko bili review jo sulit ila. Ni review gud na jang ito anit sigur na kalwalo tinirinatamini.
Finally, this afternoon, residents of Iqaluit may notice Iqaluit Public Health doing COVID-19 swabs at the Cadet Hall. This is surveillance testing that has been set up to aid Iqaluit Public Health in its effort to test those who have been advised to be tested and have an appointment. It will allow us to do more swabs, get results faster, and expand our reach into lower risk contacts. Please do not go to this location for swabbing if you do not have an appointment. If you believe you've been exposed to COVID-19, call the hotline at 1-888-975-8601. Those under isolation will continue to have a nurse go to them for swabbing. Also, if you see people you know in the line, do not assume that they have COVID. Testing is an important tool to track the virus, and it works if people cooperate and avoid and recognize that stigma and shame hurt those efforts. Thank you.
Kiulla paami unnusa tamakko ekalummiu haujinaartut sauvut ekalunni khumainen aambingin annaasiorti Nunavut 19 mi haujisaut tarneangata sorlungu taikani unalitsajakalaakku taikani illungani tamanna haujisarni tuinnaajo taanna taussima jo ekalunni annaahernangittuleriyikungin taikko haujisartauhullugi haujikkartaussima jo initsaliortaussimallutilu Taako amisuunersani haujisakkannerutigigunnarsinaaqattigu ammalu saqhirtaujuna hilamiunersakku haujigutiginaarattigu tamakkununga ulereanartumiinginnersanu katijausimajuminernu. Tabbonga opagutitteilitsiaari haujisartaugumagiartullutit initsaliortaussimangikkuvin. Suliorsaruvi taimaa katijakartsuminiugaami Nunavut 19 limmik uqaalagunnartuti uvunga 1-888-975-8601. Taikkoa suli anitteiligeli suli upattauhattarnearta annaasiortinut haujisartaugutitsani nuatsiviugaartulluti. Ammalo takuguvi taikani utaqqijunni haujisartauvalliajuni malugusutteeligitsi taikkoa Nunavut haujisarni tamanna pimmariumma haujisarpalliaanarmu tamatsumiu Nunavut ammalu atuutaharunnaatsiaanga kikkutuinna yakajunnahatsiaangata Ammalo kangosutitsinne pasitsisimanerlu tamakkuninga aannerutautuinna hattarneangata. Huyannami.
Jordan at CBC. The COVID test site, how will it work? Dana kawi hakotawna to kano aulatawna pa kawi hakbiuna to me.
So individuals will be making appointments and going there to get swabbed. So these individuals right now are people that have been identified but are known to be lower risk, and either because they've been identified either being members of a group like a work site where there might have been exposure, and so we're pre-arranging it that way.
And
Hold on.
I don't. Oh, sorry.
Tamakkoa initsaliortaussima jokisani teikunga hattarneartu taimaa surlungigo haujisartaugutitsani haujisartauneartu. Taakkoa ulureanortumiinginnersaugelua katijaussima ju taakkoa naluneartaussima ju surlu katijahartuminiutuinnariaharningin eqanajarbinni.
And I don't recall other communities that had COVID testing sites. Why Iqaluit? Is it because of the population, or why did you decide to open a site? Tana nunaling ni tuha malang inama nubagyana mo aktok tawlaw to ni kawai hak bigtalaw ni kok mata ikaw maniku hok ni kaya kalung ni pitak pa amihulong ni luba kalung miuta.
That's incorrect. Other communities have had sites for swabbing outside of the health center, where in at least one community the staff had people drive up and then they'd run out and swab them in their car and run back in. So it's a quicker way to get swabs done, and when it's done for involving people who are low risk of having COVID, it can be done with minimal risk of spreading it.
Tanna tammaktei asingin nunalin teemei hattalaumiju annearbingata silataani ilanganni nunalin taakkoa nunasiutikkuussuti nunasiummi teemaa haujisaqatsani nuatsiqattalaumiju ammalu tamanna hilamiunersakku haujisaqatsani nuatsivitsaammaat ammalu ulureanartumiinginnersauju tamakkua ulureanartumiittitautaagati.
Savikataaq, Untitled News. Just a couple of clarifying questions. You mentioned the 50% capacity for establishments. Where is that outside of Iqaluit and Kinngait?
Tästen pitää nunatsiaa kun ni taakkoa pekkuti ila uqauseriqqauja ja abballuangi taakkoa imirbiuju namiuga yaqngatamaani qalunni kingaarnilu.
That will be in all restaurants and licensed facilities across the territory.
Taakko ilunangin nerivinni imirbinnilu nunavulimaami.
Nami anak.
Just another clarifying question. There were 8 recoveries today, and then there was another recovery earlier. I saw that the total recoveries today on social media was 8. Is it actually 9?
Takwa hausa kauya ti ngugangi kanu igu taharon ner temini unarasugi harisao yakullu ila nalo nagalama 9 ngubakai.
That would be my understanding, but has there been a math error on that? Pardon me? 9 in total. Yeah, correct.
9 katilu ya kanu igu ner utahasimayu. You guys.
Trevor Wright, Nunavut News. Do we still have established links between all the cases, active cases currently?
Trevor Wright Nunavut kunni takwa tukangan ni kamanga takwa katiyaw simayu ni takwa sa inawat suli nuvat juan simayu.
There's one of the newer cases that we're trying to, the contact tracing staff are sorting out the links right now.
Tan ano tango na pa how yaw simayu na lunak taw simayu takwa katiyaw simayu ni man na how isak palyayo.
How is the, I guess, general risk of exposure to the general population with 2 bars now identified as exposure, having potential exposure?
Hanoliki takwa kikuti nam no lugar nak tumin na takwa makko emer biyo na lunar biyo simalang ati pataw simayu miniwang inovat juan nak tulin hanolugar nak tumi gutaw nakka.
The exposure risk outside of the sites that have been identified is pretty low. Almost all of the cases have been identified through those sites, and the rest have been through being identified as contacts of people who were there. So if you weren't at one of those bars or at one of the work sites, chances are low that you've been exposed to COVID-19 in Iqaluit.
Tamakwa katiyaw yuminiw tuin na kaili ulugan nak tumin ningi takwa sila tani tamakwa emer biyo ulugan nak tumilo ang ituin takwa ilu na tikasa nalo na taw simayu nalo na taw simamata nuvat juan nak tutaw simaningin ni tay kanay tuminiw ningin not ilang ilo ilang katiyaw yumini kikos takwa nung emer bimor ningi tu arot si balo tay kuno kanaya bingin no tay ma taman na kalumeo no ulugan nak tumilo ang itus suli.
Jordan at CBC. This one's questions from Savikataaq, Palm Beach. They're asking why the Baffin travelers that are here for medical are not being asked to isolate before they go back to their communities to prevent the spreading. Tana akariyaw law to hanirayang mi ho takwa ikalung no anya wila kimayu ublo ni 14 tamani help titang mga ta nunaling mi no utek kakit nagi amihung ulo daily tichinang mo atong nagpata.
The unintended effects of restricting travel in and out of Iqaluit the way we do with other communities would be immense, and it would also start to limit access to emergency medical care here in Iqaluit and other consequences like that. So it's since last summer we've known that we would not be able to do that for Iqaluit.
Takwa piyaring ikalwang luti sulutak to sisikatan ng mga kalong nitikibiugon ng ningin asing inununalin no piluak to alo gayang ata. Takwa alo atu inahawang niyang naksaw gayang ata to awang natukusulaan na bimin inulisak tawag na ng mutamaan niya kalong ni asing inulatu inakalwa gayang ata. Maaw yaw law nga nita imanalo na sisimalaw tugutaman na ikaloy isulit tabi kalwa ako nago tutabi ulo ang ning ano.
Jo mo ko to hama lek mga pi kano takwa Canadian North ko lek mga ta ang umadak mga talo. The question is do you have an update on the situation with Canadian North and their cargo services?
Takwa ting mahuli ko Canadian North kakhimalak to takwa pekotini uhit tang na tamonga Nunavut mut outla chelak to anguti himalak to hanultat outla chelak to. Thank you. Canadian North cargo is caught up. Everything, all cargo flights are back to normal, and all to the best of my knowledge, the stores are either stocked up or stocking up with all their food.
Savikataaq, that's F News. My next question is to Dr. Patterson. Do you have an update on whether or not these cases are a variant?
Tästä patai nunat siya kun niyo to saktit siya kun nakita ko at nuvat jo anak taas may asingin niyo mga tatay ko nga asid si palya yun.
No, we're still waiting to hear the results back.
Gasuliw takhiya ko.
I was wondering if you could explain the timeline for adding the chart room. It was just about a week after the storehouse was added, so what factored into that decision?
Takwa nalo na tayo litay na lang tayo na imek be chart room mo nakataw yo pinasa ko sa tayo sinasimalak tilugo kano taman na sumat.
After we put out the announcement about the storehouse, a little after that, we identified individuals who had been in the storehouse on one night and then went to the chart room, and the contact tracing there identified individuals who had been in the chart room on that night and the nights after that, and have been diagnosed with COVID-19. So that was the process in identifying exposures at the chart room.
Tayo nalo na sila tillo tayo ko ni silo ami imek be meeting ni yun how you care who you look at how you care how you tayo ko at kani silo ami imek be meeting ni unno say nangani takano nga chart room mo tumini ulang nga tayo manalo na tayo lakis may tayo matukangan ninginik tayo kani unno ngani tayo kani tumini how you kaktaw valya yu tamalutan na nalo na tayo lok tuni nuka jo anak tayo tumini uninganik tayo kani Kinngait chart room me lok tillo.
Trevor Wright, Nunavut News. I previously mentioned vaccination numbers for Iqaluit. What are those numbers currently?
Trevor Wright, Nunavut ko ni takwa khatsi ba halun ni kapayaw si mayo.
Thank you. So, as of April 18th, the total doses administered in Iqaluit were 6,238. There's 2,545 people who've received both doses, the remainder have just received one dose.
April 18 mo no katityo kita ko halun ni kapayaw si mayo 6,238. Tapaki ni kapayaw si mayo 2,545. Teko ami akong sulat daw sa to kapayaw si mayo.
Had the vaccination rollout not been in place or ready prior to this outbreak, what would the potential situation be, I guess?
Tako kapayaw si man ni patat amisut. The
evidence all over the world is that the vaccination, especially when you're looking at significant numbers that have been vaccinated, it slows down the spread of the virus, and it doesn't spread as far. It doesn't infect as many people.
Tako how you yaw si mayo not jolly mami ullo mi mo tako kapayaw si matillo yami sooner said tay ma sukkay na sawla hatta to sa makpalyan nga amalo ami sungin na say kanin magut sa hatta ko ni si masu tay ma kapayaw si malaktillo.
Matisse Abdi from Radio Canada is asking if some age groups are getting less vaccinated than others, Yukon and NW2. Yukon and NWT health authorities have noticed that young adults tend to be less vaccinated.
Mati Sarvik Radio Canada kunitatsima hakutjanga khatsini ukiulita kwa kapiyang inaksaw kataka Yukon minunat sermilo naluna sisimamata makutui kapiyang inaksaw katangingin.
That's a general trend across the country. That's, I think, true everywhere where it's open to everybody over 18, that the younger groups are not as likely to get vaccinated.
Tamanna teimeiga juttu kanatalimaami tamanna suliyo sulu tamakko kiuli 18 ni wataanillo makkutui kapiyang inaksaw kattaqtui.
Patterson, Tech News. I know that you had talked about this a while back, but is there any use in trying to have something like a contact tracing app here in Iqaluit?
Tana takutiu kattaqsimayo wala taanela Dustin Petai uqausika kattaqsimaga viqaqisaw yakku katiyawsimayuni pitaqarunnaqayarmanga uqalautiqalakku.
Our understanding from other jurisdictions is that even in areas that have wider use of cell phones and better cell service, is that they're not as useful as they were advertised, and so when you add that in with our other challenges, it doesn't seem like it's worth the effort.
Tukisima yakku asingin ni kanata miavittussima viuyuni ma qaqisaw qala hatsaaqaluartillugi ikiaqqivikkuuruti hatsaaqaluartillugi atuuti hatsaanginneqartaus mammata tamaani samagijaangitsaamarittavu.
The two places in Kinngait, do they have any travel history to Iqaluit?
Taku amakku nuvajoanartaartu kingaarni iqalunnuussimayuminiuva.
The two new ones or the original two?
The two new ones.
No, the no travel history, they're directly linked with the other individuals.
Gaulalaus mangittu taavani kingaarni searmarbiuyumini.
Trevor, Nunavut News. I just have the one. All the cases in Kinngait are the same household, or are they different houses?
Trevor Wright, Nunavut kunnita ko kingaarni nuvajoanartaassimayu illumiu qatigituinnaava.
They're directly linked. That's about as much information as we're going to give right now.
Taku atoqaangani qatuinnartu taimao qatuinnalangayu.
Jordan from CDC. What workspaces have been identified as risk?
You have to keep in mind that the chart room and the storehouse also serve as workspaces. There's people who were working there in Canadian North.
Iqamaya hatta taikani qanayartitaharmimma chart room yammalusterlo emerbengani taku iqanayarbiummata malo Canadian North ko hangatayuleriye.
Patterson, Tech News. With 9 recoveries so far, is this the timeline you were expecting to see recoveries in?
Dustin Petai nuna chekum nitakwa 9 ngutillugi qanuigunneersamayu taimaatsia taimaigan ila qanuigunne pallianaqa.
So the timeline or for declaration of recovery is based on 10 days from when somebody became symptomatic or was diagnosed. The reason it's starting so soon after the announcement is that there was a few people who were symptomatic before the first case was diagnosed.
Taku hangauga yamningi sulu naluna sakhatarnarmu qanuigunneeruti haqqalliassimayuni ullu yakhulinaalauttillugi qanuiguti haqqalliayuminiuningani kuppaluni naluneertaularningani qawiyasartaunikku taimai makhilamiunersaulortu tamakku qanuippallia niuju naluneertauvallianingi tainna qanuiguti haqqallianerga ilanga taima naluneertauyaqalaungimmarittillugu nuvajuanartulimmi.
Just a couple technical questions. Is Kinngait considered an outbreak now, and are we still rolling out community transmission in both communities?
Kinngait tayo manalo na yung nasiviw no nalingani sa mapalyan ulang ningani tamakin nilo ni tamani ikalun ni Kinngait.
So in Kinngait, transmission has occurred in the community, so yes, it meets that definition. There's no, there's direct links in all the cases, so there's no evidence of community transmission in Kinngait at the moment.
Kinngait taman na sa maktumini yung manunalin ni tayo tukingin ni tayo may sakto kasi ani turangan ngin namo nga nakki sa magbimini yung mga tatay may nalunay tayo nang ito suli no nalin na sa mapalyan yun ngani.
In Iqaluit, there's one case that we do not have a link at the moment, and that's the priority for the contact tracing staff.
Ataw sila na kalun ni na mo turangan na mga sa mabiw ng mga nalunang atay may mata na sibulak pa jaw titayo katija miningin ni kawya sakpadlanik no.
If majority of cases are coming from bars and not households or workplaces, what does that tell you about the public health measures that you had in place prior to this outbreak?
Dako may sunak sa imig binisa magbiyo mini mata ang iluging itang inang karyaw ito ni taman na kano tukihak sobyo.
That they needed to be adjusted to reduce the chance of events like this happening again, and that's why in the announcement today we mentioned dropping the capacity in those restaurants and bars.
Tayo makakakiyap tayo si mag-elimin yung galawa tayo masama palala ko yun ata tayo makanir tayo may mata na nalo na tayo kawag takwa katsiyo kung namningin o kakong namningin naribi may bilo abatoy na kailangan matoy kanir kata.
How will the new Iqaluit Public Health kind of testing site push the testing capacity that we have right now?
Takwa na hamang itulari ko kawya sa katatilubi kanutigi tayo makawya sa katakong naktigi bita.
Do you mean in terms of the number of tests per day? It won't overstretch our current capacity right now. If we expand that and are doing more tests per day, we have other options. We can send some to Rankin Inlet, and we can also send lower priority swabs south for testing there.
Takwa katsiyo mga taulo taman kawya saktaw kung naksikat to man na yo amigak si jang ito tayo makawya sakpadli atin lawit. Kasi ani amig sunod sa kanang ni kawya sa kaya ham na ruta asingin ni nalira ko sa haptugo. Kangas sinang mok taulo tik ubalo tamak ko ulo ka nak tumingin sa halo nano kawya saktaw gak katakon na kayak mayuwi.
The 11,940 Nunavut who are fully vaccinated, do you know what percentage of the adult population that is?
11,940 no na bumiyo kapiyaw sa malakti utamakin ni kano tigi percent tigi baw no na bumiyo lima.
There's I can't remember off the top of my head, Dustin. We'll get the numbers for you. Get that for you later.
Atsu dako kay tagun na lang ayo.
Jordan from CBC. If a question for Patterson, if a person has COVID and not showing any symptoms who gets the vaccine while having COVID, will it be harmful for the individual? Tana aperiyo Dr. Patterson mo kinamenuba janang mo aktok tao himanayak pa kanuing itap do yaklo ni lu kapiyaw na yak pa tamna pitchang idjutaw yung napa.
Not that we know of.
Kawya mayat tigo aga.